I want to quickly lay out a framework that I use when I teach people about addiction, and it's something I call the current of addiction. If you talk to people with active addictions, it feels very much like you're being swept through a current. And so you're brought from one end to the other, and it's very hard. It feels compulsive and like you can't stop it. So it starts always with some kind of pain. That could be major depression, a trauma. It can also be small things like boredom, not happy with a marriage or where you're going with your career or life. So there's some pain to be dealing with. The mind then comes up naturally with a way to get out of that, and that's what a craving is. A craving is nothing fancy. It's nothing more than just a way that you want to get out of that pain. So that's the second step in that current. After you follow through with that craving, that's the addictive phase of this current of addiction. So when you partake in the craving and you get into that part where you give up and give in, that's the addiction. So that's now the third. So we have pain, we have some kind of craving, then we partake, and that's the addiction phase. And the last part of the current that's often forgotten then is that at the end, it's this idea that I'm going to be in a pleasurable, euphoric state. So that's where we're distracted or euphoric and get through the original pain. Of course, it's a false pleasure, and then we go round and round because the false pleasure ends in destruction, causes more new pain, and we go round and round. So it's more shame, more pain, more stuff to escape. So that's the current of addiction. There's also a way out, which is to live in a healthy manner where you step outside of the current and you're above it. And so there's a lot more to learn there as well. But I hope you understand just a little bit more.